Welcome to the High Impact Medicine podcast. In each episode of this series, we talk to a medical professional who is pursuing what they consider to be an impactful career, alongside or learning from previous clinical practice. Today's conversation is with Anju Goel, who studied at Stanford Medical School before moving into the field of public health. She has a strong interest in global health work and has had a diverse range of career experiences. I think she comes across as an expert in designing her life to suit her strengths and values. I hope you enjoy the episode. Let's dive right in.
I actually never really expected to go to medical school. I wasn't one of those people who knew when they were very young that that was what they were going to do. About halfway through college, I made that decision. In about my third year of medical school, I became very interested in global health, and it was a result of me feeling rather disillusioned by the way that healthcare was practiced here in the United States. What I saw was a lot of interventions, a lot of very expensive interventions, without necessarily much of a positive effect. And I, although I had not had experience with global health at that time, it seemed to me like there was just something wrong with that system. And I've always believed very, very much about preventing health problems through lifestyle rather than treating them once they're present through sometimes very high level interventions. So I was talking to somebody in medical school about how I was feeling kind of disillusioned with the whole medical system. And she asked me, well, if you could do anything that you wanted in medicine, what would it be? And I said, I would like to practice global health. And she said, well, why don't you do that? And at the time, it didn't really seem to me to be a possibility. This was in the 90s before there were so many different overseas programs for medical students and for physicians as well. Like there just weren't very many programs at all. And there certainly weren't any formal programs where I went to medical school, which was Stanford in California. Um, and so I thought a lot about what she said, and I ended up creating my own programs overseas. So I spent an extra year in medical school and just spent a lot of time digging around on the internet and talking to people and trying to find opportunities. And it was particularly challenging because I needed to find opportunities that were funded, that at least covered airfare and room and board while I was there. And I was fortunately able to find several of those, a couple in Asia and one in sub-Saharan Africa. And that really changed things for me. So I could see there how great the need was and how so little resources could go so far, which then, of course, just reinforced my belief that the US medical system was not functioning in an optimal way. It was really using resources um, in a way that didn't feel to me ethical when so much of the world was living without the most basic things. To have people have so many interventions, even when they wouldn't necessarily result in a very significant increase in length of life or quality of life. So I went on to do an internal medicine residency, a primary care internal medicine residency, and I did it in the South Bronx in New York, working with a very underserved population, mostly Black and Latinx. Um, and then I actually didn't love the clinical care. I didn't love it. So I saw the same problems there that I saw in medical school, which was just a lot of resources being expended on things that felt like band-aids to fix the problem, instead of dealing with the underlying issues. So I didn't love it, but then I decided towards the end of that residency to do a public health and preventive medicine residency, and part of that was getting a master's in public health. And with that, I felt very much more at home. It was much more consistent with my belief system of making higher level changes and prevention. Um, and public health, there's a very many people who are in public health are focused on global health. So I felt like I had found something that was just a much, much better fit for me than clinical medicine in the US. However, my career course has been a little complicated and circuitous. So, what I had envisioned for myself when I was going through that public health training is that I would then go overseas to an underserved area and live overseas um, and do public health there. And that didn't actually happen for a very common reason, which is that I had a lot of obligations here. I had a family, I had a young child. I had a partner who was on a different career track, and I had obligations here that didn't allow me to do that. And those obligations kept me busy for a very, very long time. And it's only in the last 5 years have I been able to go back to that original love of global health. And I've done some considerable volunteer work in East Africa. And then I expected that when my child went to college, I would transition full time to global health. That transition hasn't been so easy, and in large part, it's been because of COVID. That's very much changed everything about practicing overseas, and most programs pulled back their U.S. staff for a good chunk of the pandemic, and some programs are just starting to place people back in the field. So that really changed things. I also have had some really wonderful opportunities as a result of COVID. So I'm working as a medical officer with the CDC, and I've actually been with the CDC since the very start of the pandemic, in April of 2020, the start in the US. And that's really afforded me some wonderful opportunities. And um, I do still want to do global health, but I'm also very happy with where I am right now. And I'm just going to continue that for a little while. Yeah, but I do expect at some point in the near future, and I'm certainly looking to do something more globally focused, which is really what I've always wanted to do.
And over the time that you spent working in global health, what has been the most enjoyable project to be a part of?
What I've really enjoyed the most is my work in East Africa and Rwanda. So I worked with an organization called Life for a Child, and I'm actually a board member of that organization. And they work with the youth with type 1 diabetes. Um, and they partner with an organization called the Rwanda Diabetes Association. And actually, let me clarify, Life for a Child works with youth with type 1 diabetes all around the world in 40 plus countries. But they had a particular opportunity and need a few years ago for a provider to go to their week-long overnight camp in Rwanda and assist. And I was very eager to do that, jumped on that opportunity and really enjoyed it. And then went back the next couple of years. And then, unfortunately, they haven't had camp for the last 2 years, but they're starting up again. I was also really involved when I was not in country, like working on protocols, having meetings to organize things. And coming up with all kinds of ways that we could change processes and keep the youth there safer. And we made some really significant changes there. So when the youth with type 1 diabetes have a very low blood sugar, they will often seize. And at camp every year, there would be about a half a dozen youth that would seize. And we implemented some changes like monitoring their insulin injections and actually advising them on how much insulin to take instead of just keep leaving it solely up to them. And then also recording how much insulin they took when so that we would understand how much insulin they had on board, which affects how much you need to correct a low blood sugar. Like if it was hours ago since somebody had insulin, then they don't have much left in their body and you're not going to do that much. But if it was recently, you're going to give them more glucose to bring up their blood sugar. So when we instituted those changes in 2019, we had the first year with 0 seizures, the first year in the history of the camp that had been going on for about 10 years. And I think that that was a really significant achievement. And I hope that that'll continue and those processes that we put in place will continue when camp is resumed. But that has really been my most rewarding work. All of the work that I've done overseas has been as a volunteer. So the year that I spent as a medical student, it was all unpaid. I was paying tuition. And then this work for Life for a Child and the Rwanda Diabetes Association. And then I've worked with a couple other organizations in the Caribbean in the last few years. But that's been really my most satisfying, rewarding work. And it hasn't just been my most satisfying reward work in global health. It's been my most rewarding work in my career. Like even when I compare that to all of the paid work that I've done over the last 20 years, um, that really stands out. Like it really felt to me like we were doing something significant there, like really significantly impacting people's lives and trying to provide them with a lot of education so that they would then be able to make some changes in the way that they were managing their own condition because they can't really rely on healthcare providers to do it all. There's just not enough. There's not enough of them. There's not enough contact with them. And so I think we're really making some significant changes there. And of course, the work that I've done with COVID has also been, that's also been very rewarding and fulfilling. But there have been many, many people working on that. Whereas when I was here, I was the only healthcare provider at the camp. And historically, that camp hasn't had healthcare providers. So I was feeling a gap there that I don't feel like I've done so much with the COVID work. Certainly, I've been involved with COVID for 2.5 years. And the work that my teams have been doing has been significant, but it hasn't been, I individually haven't played as significant a role, I think, as in the global health work. And that's often the case with global health work because there's there's such a deficit of providers for the population. So so even if you go and do relatively small things, it can have a ripple effect. Yeah.
When you're sharing the type 1 diabetes insulin adjustment information, I recently learned about the Daphne program here in the UK. Stands for Dose Adjustment for Normal Eating. Apparently, it's an educational program that was taken over from Germany, and it's been super effective just at teaching patients how to properly dose their medicines. And I think these educational programs, we could have a lot more of them, and they could be more effective. And I wonder if you've been involved with similar things.
Well, can you tell me more about that program, the dose adjustment for normal eating program?
Sure. Um, it started off as a residential program in Germany, and then it was taken to the UK, but it's not a residential program. But for a week, patients are taught how to dose their insulin around things like the diet they have, the exercise, drinking, other things. And it just means that there's a lower risk of them getting hypos, so them getting hypoglycemic, and they improve the way they take their medication. And I just sat in on a clinic on Monday, and both the professor running the clinic said this was the best thing that's happened in type 1 diabetes care in the past few decades. And the patients as well kept saying it was just amazing after they did their Daphne educational program.
Okay, so that general concept is a standard part of type 1 care and has been for many years that you dose your insulin, you adjust the insulin. You're not on a fixed dose of insulin. You adjust it based on your activity level, your food consumption, whether or not you're ill, sometimes around menstruation. So, so that's just a normal, like standard concept of type 1 diabetes care. But I think that people could always use more education around it. So we did a lot of that in Rwanda. And um, there are also overnight type 1 diabetes camps here where they do some of that. And of course, with healthcare provider visits, which are, at least every 6 months for youth, the type 1, you do a lot of that. So what you're talking about sounds like maybe a more intensive version of what's already part of type 1 care. Like there are places where there's less adjustment. So like, for example, in Rwanda, like people would generally take the same doses every day and they wouldn't have fast acting insulin. So these types of adjustments are particularly helpful with fast-acting insulins, but there are places with fewer resources where you need to adjust your lifestyle around the insulin rather than adjusting the insulin around your lifestyle. But we are fortunate in developed countries to be able to have fast-acting insulin and insulin pumps and continuous glucose monitors to be able to really lead a pretty normal, healthy, active life.
So in Rwanda, they were having to adjust their lifestyle around their insulin.
Yeah, and I don't think that that's so unusual. Like for example, you have to eat at a fixed time every day. And they were not using the ultra fast acting insulins. They were using regular insulin, and then a longer term insulin called NPH. So the thing is, it takes hours for those insulins to peak. And so once you have injected yourself at a given time every day, you must eat at a certain other time, like several hours later, you must eat. And if you don't, that insulin is going to peak and your blood sugar is going to crash. Whereas when you're in taking these fast acting insulins, like in an insulin pump, you don't need to do that. Um,
It's very fascinating how it's highlighted the different spectrums of medical care accessible to people. And really like, yeah, how lucky and high tech medical care is in the West.
mm.
Um, okay. What does a typical workday look like for you?
Well, so I would say that the last few years have not really been typical for me or for anybody else. Um, so, so for the last few years, I mentioned that I've been working with the CDC since 2020. I've also worked with the LA County Health Department. I worked with them for a year, also on COVID, managing outbreaks in mostly their long-term care residential facilities. And now what I'm doing is I'm part of a team that manages and responds to questions from healthcare providers, complicated queries about COVID-19 vaccine. So on any given day, I could get a query and then do a literature search, interview the provider, get more information, do a literature search, see if there's any information about their specific question in the literature already. Check a database called VAERS, which is the Vaccine Adverse Event Reporting System. It's a national database that anybody can report into when they have some sort of reaction that occurred after a vaccine. So it doesn't necessarily mean that the vaccine caused it. And it's not just for healthcare providers. So patients, for example, family members, anybody can report into it. And we look for trends in that. So we're looking for signals where we have a higher number of X conditions than we would expect just by chance alone after vaccination. And then I draft a response. We also consult with subject matter experts across the country at various academic centers that are contracted with the CDC. Um, and then draft all of that information in a response to the provider to help them make a decision about how to proceed with their patients. I also edit articles for a couple online health sites, and I do that sort of intermittently throughout the week. That's only a few hours a week. And right now, I am also interfacing with CDC staff that have COVID symptoms or have tested positive or have been exposed. And for a period, we were also doing some contact tracing, and that's no longer being recommended. So yeah, it's been quite a mix of things over the last few years, but I don't think any of it has really been typical or predictable or what I would have expected.
And going forward, how do you navigate the opportunities available to you? How do you think about, like, what are your priorities to get out from the work?
Yeah, that's an interesting question because at this point in my career, so I've been in medicine now. I've been a physician for 23 years. Um, and I expect to continue working for about another 10 years or so. And then probably after that, I mean like full-time work. And then probably after that, I'll always continue doing something in a reduced capacity. So I have definitely been putting a lot of thought into what I want this last phase of my career to look like. And my ideal would be to have it be global health, even though, it's taken me an awful long time to get there. This is not what I would have imagined my career to look like 20 years ago. But really, my ideal would be to be able to go overseas and work on some sort of either infectious disease or chronic disease condition for the next decade or so. Yeah. But we'll see. I mean, I'm flexible. I mean, I have seen over and over in my career that is very hard to predict. It's very hard to predict what's going to happen in life and in work. And there have been all kinds of opportunities that I never expected or even knew about, particularly as a medical student. Like, I didn't even know that you can have this type of trajectory. Like, I just thought as a medical student that you either go into clinical care or you go into academia. Like, I didn't know that there were other options. We were never really told that there were other options. But of course, there are a million other options, and they're mostly created by your own ingenuity. And yeah, so I'm hoping that maybe some more things that I haven't even thought about will occur in the next few years.
And you studied medicine and you practiced as the physician for how many years in the clinic?
Well, I haven't done a lot of clinical care, so I've done some limited clinical care over my career. So I did the primary care internal medicine residency and then public health and preventive medicine residency. And then I did just a brief stint of clinical care along with public health work, and then really turned to public health work for the next 6 or so years. And then had a couple years, about 2.5 years, where I worked in private industry and software, medical software, and then went back to public health. And then I actually so I did a couple years with a startup that did home health care. It was seeing people, this was before COVID, it was seeing people with mostly pretty low level health problems and mostly not chronic conditions. But for the most part, like, it was pretty clear to me early in my career as a resident and even as a medical student that I didn't want to do clinical medicine. So I haven't done a lot of that. Although I would say that having that experience and that knowledge, it's very much been an asset. Even though I haven't practiced a lot of clinical care, I have a very good clinical sense of things. Like, I have very good um, sense of when something is serious and when it's not serious. Yeah, I think it is important to at least get the clinical training, because I think it does inform everything else you do, even if it's not direct patient care.
So that was going to be my question. How do you think having that medical background has been an asset compared to maybe your colleagues in global health that don't have that?
Oh, so you just mean being an MD as opposed to actually having a clinical residency?
Or both? Like another question as well for people who are thinking to transition maybe into this career path is how long to stay in training for.
So I haven't met a lot of physicians who are in global health that don't have a clinical background, that haven't at least done a clinical residency. Now, you only need to do 1 year of internship and then you can get licensed in the United States. I'm sure are people who do that and then go into a public health and preventive medicine residency, but I haven't met very many of them. Most of the people that I met have many degrees and fellowships and qualifications, and like probably more than they need. And how is that different? And my work also has been mostly with physicians and not with, like, for example, people that went directly into an MPH program after college. So it's a little hard to say because I don't really have a comparison. Like, I don't have a comparison of physicians that don't have clinical training or experience. And I don't have a lot of experience in the global aspect with people that don't have a medical degree, that are not locals, that are like American volunteers or European volunteers. So what I was doing in Rwanda was very clinical. It was very much like figuring out insulin doses and advising people on doses and lifestyle change. That was all very clinical. Yeah, I think I just don't have enough of a comparison to be able to say that.
I mean, it's interesting that most of the roles are occupied by previous physicians. Um, and just to sort of start rounding up, what kind of things would you recommend to people who want to move into global health? What should they do to best position themselves to get a job in the field?
Well, now there is no shortage of opportunities. for medical students and for residents. I am just so impressed with how the field has exploded, and there are formal programs now for medical students in so many different places and for residents as well to go overseas. And that kind of thing, it did not exist when I was training. There was one small overseas elective when I was a resident, but it wasn't open to everybody. And that was also very unusual to even have a program that has that. But now it's very widespread. So I would say take advantage of those opportunities and take advantage of multiple opportunities. It's a little hard to know though that you really want to do it until you've actually done it. Like it might theoretically be very appealing, but I think you have to actually do it to know that you're going to love it. It's kind of like with medical school. Like I do question when people make a decision very early about medical school because you just simply don't understand what medicine is until you start doing it. And it's a difficult career path. It's a very difficult career path. And yeah, I mean, I guess that may be the the way that a lot of things in life are. You don't really understand it until you do it. But particularly with global health, like there are a lot of reasons that people would find not to do it. It can be uncomfortable, it can be inconvenient. You can be separated from your family. You're often not being compensated very well. You are often not living the same lifestyle that you would have in a developed area. So it's not for everybody. It's really not for everybody. But the only way you really know is to do it. So you can do it in a lot of different capacities. So like you can do it as a career person. So the CDC, for example, has positions that post overseas for 2 years at a time, and then they renew for another 2 years. And so you can move there and plan on doing continuously. There's Doctors Without Borders, Médecins Sans Frontières, MSF, which will take people for about 9 months at a time. There's Peace Corps. They have a new program called Advancing Healthcare Professionals. It's 3 to 12 months, but most of the programs are around 10 months. So you can do like brief stints. You can just go and do your own independent or not independent, but like you can just find some organization and then arrange something, and then there are like those Operation Smile type things that go for like a week at a time. So there's like a wide spectrum of global health practice that you can do, but I think you just need to try it first and see if it really suits you and how much of it really suits you. Because some people they would just love it for a week or two at a time, but they might be quite unhappy doing it for years. They might be quite unhappy or feel isolated or just not thrive doing it for years at a time, particularly if it means you're apart from your family. But you don't have to make that decision now as a trainee. And just like practicing medicine outside of global health, there are just so many different ways to make it work for you, to find what works for you. And I think one of the reasons that medical practice has changed so much is because there's so many more women in it now, and we're not, for the most part, we don't subscribe to this old culture where you just give medicine everything and you got nothing left over. Like for many of us, that just doesn't work. It's not what makes us happy. It doesn't lead to a fulfilling life. So we found ways to change things and make it work for us. And I think that that's something that I have been very successful at over my career is making it work for me, finding opportunities to suit the kind of lifestyle that I want to have and keeping things as balanced as I can in my life. But it very much requires initiative. It very much requires thinking creatively about how you can do things and creating opportunities for yourself and being very persistent and sometimes not taking no for an answer. But I just never imagined, 25 years ago as a medical student, I never imagined that my career would take this trajectory and that any of the things that I have done was even a possibility. And I feel like those changes and those possibilities, they're just going to increase over time.
That's very good to hear. Do you have any favorite maybe books or reads that you'd recommend to listeners?
So there is actually a book that I recommend. So I mentioned that I went to Stanford Medical School, and there are a couple people that worked in the business school there that wrote a book called Designing Your Life. And this book's basic premise is that there is no one correct life for you to lead. Like, you don't need to find your one passion that's out there. You don't need to just identify it and then go down the straight path and lead the perfect life. It's that there are many possible lives for you that are all good lives. There are so many different things you could do. There's so many parts of yourself, and you just keep trying new things and keep iterating until you find you create a life for yourself that's very satisfying, that's very happy, rewarding, fulfilling. I think particularly in medicine, we get focused very narrowly that this is what we must do. We must go into medicine, and then we must go into a particular specialty or a particular residency program. And I think in the big picture, those kinds of beliefs are not helpful and they're not accurate. At the time, they feel very true, but I think the possibilities are limitless if we allow ourselves to think more flexibly. So I encourage people reading this book. It's a very interactive book. It's an easy read, but it's interactive. It has exercises, again, called Designing Your Life. And then there's another version called Designing Your Work Life. And yeah, it is great for people who are just not quite sure what they want to do.
And how do you think about impact in terms of the work? How does that factor into your decision making?
For me, for my personal values, for me, with my medical skills, it means contributing where there's the most need. And although there are areas in the US that are underserved, like rural areas, they're not at the same level as like a place in Rwanda that has one endocrinologist in the entire country. And not, not everybody subscribes to this theory. Not everybody, most people are not effective altruists. Most people don't know what the hell that means. Um, but those are my values, and so I have to make decisions that are consistent with those in order for me to feel satisfied and fulfilled.
Thank you so much for sharing your interests and your passion. And I really hope that the next decade you can do more projects that make you feel like you're living in line with those values.
Thank you so much. It's been a pleasure speaking with you.